Hi, I am Dr. Dures Feite Gayuna, and this is the ninth lecture of the Legal Medicine course entitled The Medico-Legal Aspects of Physical Injuries. Physical injury means the damage to any bodily tissue to the extent that the tissue must undergo a healing process in order to be restored to a sound and healthy condition, or the damage to any bodily tissue to the extent that the tissue cannot be restored to a sound and healthy condition. Or it may be that the damage to any bodily tissue results in the death of the person who has sustained the damage. Physical injury is also known as physical trauma and is the damage to the body caused by external force. This may be caused by accidents, falls, hits, weapons, and other causes as listed here. There is some form of stimulus in the body, such as what would happen if a sharp instrument is thrust into the abdomen, causing a penetrating or maybe a perforating wound, or maybe a hit with a hard object on the scalp, producing a lacerated wound. The effect of the application of physical violence on a person is the production of a wound. Physical injury and wound are used interchangeably. A wound is a disruption of the normal structure or the anatomic integrity of the body tissues caused by the application of the extraneous force. However, not all physical violence results to the production of a wound, but all wounds are always the effect of physical violence. The physics of wound production involve kinetic energy, time, area of transfer, and the other factors such as elasticity and plasticity. Kinetic energy is based on the mass and velocity factors. The velocity, which is squared, is the important factor, such that a smaller bullet that travels faster will cause more damage than a heavier bullet that has a slower velocity. The shorter the period of time needed for the transfer of energy, the greater the likelihood of producing damage. And the larger the area of contact between the force applied on the body, the lesser is the damage to the body. Finally, elasticity and plasticity refer to the ability of a tissue to return to its normal size and shape after being deformed by a pressure. The less elastic and plastic the tissue, the greater the likelihood that a laceration will result. Vital reaction is the sum total of all reactions of tissue or organs to trauma. This may be observed macroscopically or microscopically. The presence of the vital reactions differentiates an antemortem from a postmortem injury. There are common reactions of a living tissue to trauma. One is rubor, which means redness or congestion of the area due to an increase of blood supply as part of the reparative mechanism. Calor is the sensation of heat or an increase in temperature of the affected area. Dolor means pain due to involvement of sensory nerves, and of course, loss of function. Due to trauma, tissues may not be able to function normally. Wounds may be classified according to severity. A mortal wound is that which immediately after infliction or shortly thereafter is capable of causing death. The parts of the body where wounds inflicted can be fatal are the heart and the big vessels, the brain and the upper portion of the spinal cord, the lungs, stomach, liver, spleen, and sometimes the intestines. The wound can also be classified according to the kind of instrument used. A blunt instrument can cause a contusion, hematoma, or a lacerated wound. A sharp instrument can produce an incised, punctured, or stab wound. A lacerated wound can follow the application of enough tearing force, while a barotrauma is a wound that is due to a change in atmospheric that pressure. Heat or cold can produce frostbite, burns, or scald wounds. Gunshot or shrapnel wounds are examples of wounds due to chemical explosion, and of course, we have wounds that may be due to infection. Wounds can also be classified according to the manner of infliction. A hit is created by a bolo, a blunt instrument, or an axe. A thrust or a stab is made with the use of a bayonet or a dagger, while a gunpowder explosion inflicts wounds due to the projectile or shrapnel produced. Sliding or rubbing will produce an abrasion. Wounds can also be classified according to depth. Superficial wounds involves only those that affect the layers of the skin. A deep wound involves inner structures beyond the layers of the skin. Like penetrating wound is when the wounding agent enters the body but does not come out. There is a piercing of solid organ or tissue of the body. Example is the punctured stab wound or gunshot wounds. A perforating wound is created when the wounding agent produces a communication between the inner and outer portion of the hollow organs. Abdominal stab wound is penetrating when it violates the fascia, and it is perforating when the bowel is injured by the stab wound. Wounds are also classified according to the relation of the site of application of force and the subsequent location of the injury. A coup injury means the injury is located at the site of the application of force. A contre coup injury means that the injury is found opposite to the side of the application of the force. A coup contre coup injury means that the injury is not only located at the site, but also opposite to the site of the application of the course. A locus minoris resistencia means the injury is located not at the site nor the opposite to the site of the application of the force, but in an area offering the least resistance to the force applied. And we have extensive injury means an injury involving a greater area of the body beyond the site of the application of force. Injuries may be varied in type. For example, a fall from a height, or was when one is ejected from a vehicle in a vehicular accident, or when one is run over by a car. The classification of wounds should include the regions or the organs of the body involved. This will be discussed more extensively at a later date. There are special types of wounds. A defense wound is the result of a person's instinctive reaction to self-protection. There are injuries suffered by a person to avoid or repel potential injury contemplated by the aggressor. If a person is about to be hit on the head, he can raise his arms and there can be a fracture produced there. Or it can be an incised wound in the hand when a potential stabbing victim takes hold of the sharp an instrument in an attempt to protect himself. A patterned wound is a wound that is created in the nature and shape of an object or instrument and which infers the causative object or instrument, that which causes the wound. For example, the imprint of car tires on the abdominal wall on a patient who is run over by a car. Self-inflicted wounds are produced on oneself with no intention to end his life, and this is differentiated from suicide. Closed wounds show no breach of continuity of the skin or mucous membranes. They may be superficial or deep. Superficial wounds are found just underneath the layers of the skin or mucous membranes, like the petechia, contusion, or a hematoma. Examples of deep wounds would be those of the musculoskeletal injuries, such as a sprain, dislocation, fracture, strain, or subluxation. It may also be due to internal hemorrhage or a cerebral concussion. Open wounds show a breach of continuity of the skin or mucous membranes, such as the abrasion, an incised wound, a stab wound, a punctured wound, or a lacerated wound. For the superficial closed wounds, the petechia is a circumscribed extravasation of blood in the subcutaneous tissue or underneath the mucous membrane. This is not always a product of trauma. A contusion is the effusion of blood into the tissues underneath the skin on account of the rupture of the blood vessels as a result of the application of blunt force or violence. It does not immediately develop after the application of force. The age of the contusion can be appreciated from its color changes: red or purple as soon as it is developed, going to blue and green in about 4 to 5 days, yellow in 7 to 10 days, and disappears in about 14 to 15 days. A hematoma, on the other hand, is the extravasation of effusion of blood in a newly formed cavity underneath the skin. A contusion is distinctly different from a hematoma. In contusion, the effused blood are accumulated in the interstices of the tissue underneath the skin, while in the hematoma, blood accumulates in a newly formed cavity underneath the skin, as mentioned earlier. In contusion, the skin shows no elevation, and if ever elevated, it is light and is on account of inflammatory changes, while in hematoma, the skin is always elevated. In contusion, puncture or aspiration with a syringe of the lesion will show no blood, while in hematoma, aspiration will show the presence of blood and the subsequent depression of the elevated lesion. Musculoskeletal injuries include the following. A sprain is the partial or complete disruption in the continuity of a muscular or ligamentous support of a joint. Dislocation is the displacement of the articular surface of bones entering into the formation of joints. Fracture is the loss of continuity of bone resulting from violence or some existing pathology. There are several types like simple, compound, open fracture. Strain is the overstretching instead of an actual tearing or rupture of a muscle or ligament, which may not be associated with the joint. Subluxation is the incomplete or partial dislocation of a joint. Internal hemorrhage is caused by the rupture of blood vessels and may be a result of may result from the traumatic intracranial hemorrhage, rupture of parenchymatous organs, or the laceration of other parts of the body. Cerebral concussion is the jarring or stunning of the brain characterized by more or less complete suspension of its functions as a result of the injury to the head, which leads to some injury of the cerebral hemisphere. Concussion is more severe when the moving head strikes a fixed hard object as compared when the head is fixed and struck by a hard moving object. Open wounds. An abrasion is an injury characterized by the removal of the superficial epithelial layer of the skin, caused by a rub or friction against a rough surface. The shape varies and the raw surface exudes blood and lymph, which later dries and forms a protective covering known as a scab or crust. An incised wound is produced by a sharp-edged or the sharp linear edge of the instrument like a knife or razor. When this is due to a heavy cutting instrument like an axe, a big sharp bolo, the wound produced is called chopped or hacked wound. A stab wound is produced by the penetration of a sharp-pointed and or sharp-edged instrument like a knife or a saber. It may involve the skin or mucosal surface, and edges of the wound look clean-cut, regular, and distinct. A punctured wound is the result of a thrust of a sharp, pointy instrument. Common instruments used include an ice pick, a needle, a pointed stick, or a nail. The sharpness and shape of the end of the wounding instrument will determine the nature of the injury. The complications of trauma or injury. First is shock. This is the disturbance of the fluid balance resulting to peripheral deficiency, which is manifested by the decreased volume of blood, reduced volume of flow, hemoconcentration, and renal deficiency. There are three factors that produce shock. One, injury to the receptive nervous system. Two, anoxemia, or reduction of the effective volume of oxygen carrying capacity of the blood. And three, the endothelial damage, increasing capillary permeability. The other complications of trauma are hemorrhage, infection, and embolism, among others, of course. Hemorrhage is the extravasation or loss of blood from the circulation brought about by the wounds in the cardiovascular system. The kinds of hemorrhage, we have primary hemorrhage, where bleeding occurs immediately after the traumatic injury of the blood vessel, while secondary hemorrhage, when the bleeding occurs sometime thereafter on or near the injured area. Infection is the appearance of growth and development of microorganisms at the site of injury, and embolism is the condition in which foreign matters are introduced in the bloodstream, causing the sudden block to the blood flow in the finer arterioles and capillaries. Most common emboli include fat embolus and air embolism. Thank you very much for your kind attention.